Good morning. In this video, we are going to discuss about the pain pathway. Pain pathway is two types, paleo-spinothalamic pathway and neo-spinothalamic pathway. This pathway carries the sensation to the sensory cortex. This diagram depicts the two types of pain pathway. The medially paleo-spinothalamic pathway is present. This red color pathway is the paleo-spinothalamic pathway. It is carried by the C fibers. See, it is carried by the C fibers. Laterally neo-spinothalamic pathway is present. Medially paleo-spinothalamic, laterally neo-spinothalamic pathway. Paleo-spinothalamic pathway carries by the C fibers. It carries the slope pain to the sensory cortex. Slope pain means it is the poorly localized pain. And deep visceral somatic pain is carried by the paleo-spinothalamic pathway. It is poorly localized pain and especially deep visceral structure like stomach pain, urinary bladder pain. These are the visceral structural pains. The first order neurons enter the laminae 2 of the dorsal canal of the spinal cord, and it crosses the midline, ascend upon the medial funiculus, medially to reach the medial group of the thalamic nuclei, midline and intralaminar nuclei. So third order neurons start from the non-specific nuclei of the thalamus to the sensory cortex. It is not specific in this area, diffusely distributed. So the paleo-spinothalamic pathway is poorly localized because it is non-specific origin from the thalamus to the sensory cortex. It is connect with the second order neuron connect with the reticular formation and midline nuclei like periaqueductal tray and parabrachial nuclei and hypothalamus. So the person in the slope pain keep the person in the awake state due to the connection with the reticular formation. It gives the autonomic functions due to the connections with the hypothalamus. Produce the sympathetic overactivity, autonomic imbalance due to the connections with the hypothalamus. It is also emotional experiences because of the connections with the limbic cortex. Neo-spinothalamic pathway, it carries by the 8 delta fibers, it carries the fast pain. So it is in the dorsal horn of the spinal cord. It terminates in the first order neuron, terminates in the lamina 1 and 5 and releases the neurotransmitter like glutamate and substance P. It crosses the midline, laterally it travels to the paleo-spinothalamic pathway. It reaches the thalamus in the lateral nuclear group of thalamus like midline nuclei. It has a specific topographic placement in the thalamus. So it has a topographic organization specific at the thalamus and sensory cortex. So pain is well localized. We can localize the pain, we can discriminate the pain sensation, we can identify the quality of the sensation in this pathway. Neospinothalamic pathway is we can discriminate the pain sensation. Summary: pain pathway is spinothalamic pathway. It is divided into the two pathway. Paleospinothalamic pathway, the fibers present medially is the paleospinothalamic pathway. Fibers located laterally is the new spinothalamic pathway. Paleospinothalamic pathway carries the slow pain. It is poorly localized, mainly the visceral deep somatic pains are carried by the paleospinothalamic pathway. It has the connection with the reticular formation, midline nuclei and hypothalamus. So it has keep the person in the awake state. It has the emotional connections along with the pain. The neospinothalamic pathway is carried laterally and it terminated in the lateral group of thalamic nuclei. It has a well topographic organization in the thalamus and cerebral cortex. So we can localize the pain, well localize the pain, we can discriminate the pain, and we can detect the intensity of the pain also well localized, well discriminate in this neospinothalamic tract. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.